Waterloo Station this morning. Those marshalling the commuters sometimes outnumbered the actual passengers. The message to stay off trains was being heeded. But is it harming the other message delivered by the Prime Minister 2 weekends ago, that those that can't work from home should now return to the workplace?
I was a little bit worried that maybe he said that too soon, and I was like, oh no, maybe people will sort of try and take advantage and maybe travel a bit more. But seeing that there was less people on the tube actually made me think people are still kind of listening.
Were you worried this morning? Lots of people thought it would be busier than it was.
Yes, I was worried, but it was fine, yeah.
The government's plans for relaxing the shutdown are based on mass testing and tracking down who might be at risk of infection. Testing was today expanded, now available to pretty much anyone with symptoms.
Today I can announce to the House that everyone aged 5 and over with symptoms is now eligible for a test. That applies right across the UK in all 4 nations from now.
But some test results are taking a long time to get back to people, and the smartphone app, which the government fanfared would be a key part of the second phase strategy, looks behind schedule. Sounds a bit as though the progress on the app has slipped a bit. We were told to expect it to be rolled out in the middle of May, but you're saying you can't say any more than that it'll be in the weeks ahead. Are you not worried by that, and also by the fact that some of these tests seem to be coming back really rather late, like sometimes sort of 5 days or something like that? You've missed the opportunity potentially to quarantine someone, haven't you?
You are absolutely right that we need to do it bigger and faster, and as fast as we can. And we are sending a clear message as scientists that it needs to be fast. And we have to work as hard as we can to improve the timeliness of the testing system.
Look, we're learning, it's perfectly reasonable to point out, we're learning all the way as we go through this pandemic, and not just on the scientific side, but on the innovation that we need to get a grip on it and control the virus. We've always said, of course, that the steps that we might take at what is step 2 on the slides that I just showed out would only ever be taken at the earliest on the 1st of June. So we've not committed ourselves to anything at this point in time. What we're doing is giving a roadmap with maximum conditionality.
Some teachers' unions think that means the government might shift on its target dates for the staggered reopening of English primary schools.
The temperature station here, and then if their temperature is too high, then they can leave that way.
The Harris Primary Academy in Beckenham in Kent is preparing for a partial reopening in 2 weeks' time. But some unions think the government's given up on its idea of getting a second wave of all primary year pupils back in 4 weeks' time. Clapping for carers last week. The government was pressed today on whether it would waive the surcharge for NHS access, which migrant care workers have to pay, and whether it would relax the salary threshold being brought in by the immigration bill, which could keep many overseas care workers out of the country.
As Britain fights back against coronavirus, controlling the virus to save lives remains the government's top priority. But it's also our duty to continue to serve the public by delivering on the people's priorities, so when these darker days are behind us, we can focus on building a brighter future.
Government ministers were out clapping for the 180,000 EU nationals in the NHS and care sector on Thursday night, and then send a message tonight that they're no longer welcome. It's not fair, and it's not in the national interest.
Brexit, smothered in the headlines by COVID-19 for much of this year, now re-emerging just as government resources are at full stretch.
Gary Gibbon there. Well, we did ask for any minister from the Home Office to come on the programme, but no one was available. In a moment, we'll talk to Conservative MP Caroline Noakes, who was an immigration minister until last year and helped to draw up the immigration bill. But first, Executive Director of the Care Workers Charity, Caroline Gerlich, herself still a care worker, joining us from East London. Thanks to both of you for coming on the programme. Carolina, you first. Does this bill, which doesn't give you the kind of protections that doctors and nurses have, make you feel unwelcome in this country, which you've worked in now for 12 years?
Yes, most definitely. And it makes other care workers feel unwelcomed as well. I think, especially in the light of COVID-19 crisis and how care workers have definitely shown yet again how they're at the front line and how they support the NHS and how the NHS works together with social care. it seems really unbelievable that the government is pushing through with the immigration policy that still classes care workers as low skilled and still tries to show that care workers from abroad are not needed here, while they're actually working very hard to save people's lives and deliver the best care possible.
So you take objection to the term low skilled or even unskilled?
Oh, I take more than an objection, I have to say. It's absolutely unacceptable. And I challenge anybody to do a day or two of care work and then still go on to say that it is low skilled.
There is an exemption for agricultural workers, seasonal labour that would come in to help pick strawberries and other fruits. How does that make you feel when you compare your status to theirs, for instance?
Well, it does make me wonder if we are valuing strawberries above people of older age and vulnerable people, which then, really brings into the question the values that we are trying to live by. And social care desperately needs more workers. Before the crisis, we had 122,000 vacancies. Those are only going to increase, at least by over 130 people who have died in the crisis already, working at the front line.
I guess proponents of this immigration bill might say, well, actually, especially with unemployment on the rise, there are now plenty of British workers who can do the jobs that you're doing. What do you say to that statement?
There always have been British people there to do the job. That we've had lots of vacancies for years now, if not longer. So it isn't a case of people being available to do the work. It is a case of people wanting to do the work, the job being appreciated, being paid more. And I think without that, nobody really would want to go and work in social care anymore, considering that people are working for minimum wage, putting their lives, health and families at risk right now.
OK, Carolina, stay on the line. Let's bring in Caroline Noakes. Caroline, when you were Immigration Minister, you helped to draw up the bill, in essence, that is now going before the House of Commons, and you didn't include people like Carolina. Was that a mistake?
So I think it's important to reflect on the outcome of the referendum back in 2016. We have to end free movement. I think the question now is how you do it and whether you can make an exemption for care workers in the same way that has been made for agricultural workers with the seasonal scheme. I certainly listened long and hard to both those in the sector and to my colleague Caroline Dinenage, who was the social care minister at the time. And I do think that bringing this bill in, but making sure that the future system comes in a phased way would help. Having an exemption, like has been introduced for NHS workers, would help. But I think there are really difficult questions.
Right, but I mean, these are all ifs. I mean, Carolina just told us that she feels that strawberries are more valued than care workers. For someone like her, who's been here for 12 years doing this really quite difficult, badly paid job, that is an astonishingly upsetting thing to say, isn't it?
Well, of course it's upsetting to hear Carolina say that. She, of course, is protected by the EU Settled Status Scheme, so she will be able to stay, as will her family, regardless. But I think we must look to the future, and we must find a way within the future system, which will be set down through statutory instruments, through the immigration rules, to find some flexibilities. And that's what I said to the Home Secretary in the House today, that there needs to be flexibility and we need to show that we do value care workers. OK,
but specifically, will you now push, the Home Secretary, Priti Patel, and the government, you're, a member of the Tory party, to include people like Carolina in the exemptions?
Well, that was certainly what I said in the House today, that we have to look specifically to the care sector. And I've been exchanging text messages with Yvette Cooper, the chair of the Home Affairs Select Committee, on the specific issue of whether those visa extensions that have been given to NHS workers could also be included for care workers.
OK, now, if you look at the list of key workers in this crisis, it's not just, workers in care homes or agricultural workers, NHS nurses and doctors. It's also, for instance, people who collect our rubbish. Should they be exempt? Yes or no?
Well, I gave a long list in the House of people who we have been reliant upon in this crisis. And it's not just refuse collectors, it is retail workers in our supermarkets.
So they should all be exempt as well, you think?
Well, what I've said is bring in the new points-based system in a phased way so that you can react to the circumstances of the labour market. We don't know what the outcome of COVID may well be, an increased level of unemployment, and there may well be British workers who want to take on these roles. But look at the agricultural scheme, look at the land army call and how many people initially responded, but how few have taken it up.
Well, that's a good point, isn't it? I mean, we've got 120,000 vacancies in the care sector, as Carolina just told us, and we've had that for quite some time. Those jobs have not been taken up by British people who might want to, do those jobs. And that's a reality that hasn't existed so far.
That absolutely is the reality, but you have to remember that pre the COVID crisis striking, we had record employment. Now, it may well be the case that we are plunged into a very deep recession and soon have record unemployment. That will change the situation, which is why we need to have a future immigration system that allows for flexibility, that can respond to the labour market, and that enables things like the shortage occupation list to be reviewed far more frequently than they have been previously.
Just in 10 seconds, does it not upset you that someone like Carolina feels unwelcome in this country as a result of this bill?
Of course it does, and it's heartbreaking that anybody should feel unwelcome in this country. But as I said, people like Carolina have every right to stay through the status scheme.
OK, Carolina, you have every right to stay in this country. Do you feel reassured by what you heard from Caroline Noakes?
No, not at all. Extension of visas for 1 year just feels like getting care workers to stay for a bit longer, deal with the crisis, and then be disposed of because they're no longer needed. And I think there is still a huge misunderstanding about how important social care is to the economy, to the wider society, and how we really need to support the recruitment.
OK, Caroline Noakes, in 5 seconds, respond to that.
Well, I think we're working very hard to get the right solutions, but as I have said, let's have a phased approach to immigration going forward.
Got to leave it there. Caroline Noakes, Carolina Gelly, thank you very much indeed.